Good morning, welcome. Today we start this series of 8 sessions as part of the subject Introduction to Bioinformatics. And I'm very happy to have in our first session, in our first day, Paula Petrone, which is a team lead in ISGlobal, Institut de Salut Global Barcelona. Paula studied physics in Argentina, then moved to California to do a PhD on molecular complexes. Then she worked in the pharmaceutical sector for a while and came to Barcelona to do a postdoc in image processing to predict Alzheimer's disease. And today she's currently lead in the Biomedical Data Science team in ISGlobal. And she's going to present a talk titled Data Science and Health, Prediction is Better Than Cure. So welcome, Paula.
Thank you, good morning. I feel very honored for this invitation. So I'm a physicist by training, and I like to call myself biomedical data scientist by trade. And I hope that during this talk I will explain what that is and how is that closely related to bioinformatics. So you are starting this year, first year students, bioinformatics. Very exciting program. I wish we had that program when I was your age. Why I say that? So in bioinformatics, we have biology. We get to analyze a lot of data that comes not only from humans, but also from agro and from veterinary. We get to look at DNA sequencing data, genomics, gene expression data. We can work with cosmetics. We look at protein structure. How we do that? There's so much data today that we need informatics. And in informatics, we need to learn how to analyze the data, how to visualize the data, how to find patterns in the data, modeling statistics. And today, there are two emergent areas that are fascinating. And one is data science, and the other one is AI, or artificial intelligence, where I get to do my research in. So let me ask you, what is artificial intelligence? Anyone there? So from many, many years, artificial intelligence has been in our minds. And I have to say that it's in every day we have some type of algorithm that we use in our everyday living. For example, if I want to watch a movie and I want somebody to recommend, who do I ask? Yeah? Netflix? If I'm listening to a song on the radio and I don't know the name? Shazam. And if I want to know whether it will rain tomorrow? AccuWeather. I like Google. Also, I started doing windsurfing, so I use Windy app. AccuWeather, Google, yeah. So I need this floor fully vacuumed. I don't think maybe you don't still have that problem, but I love to use the iRobot or the Roomba. And if I want to know where the train station is, who do I ask? Before, when I was a child, we used to look up in the yellow pages, but you don't have that anymore. And if I know how long it will take me to get there, still Google, but if I want to get a taxi, I can use Cabify or Uber. I'm not paid by any of these companies, just so that you know. And if I know what my friends are doing today, I use Louder, Instagram, or how about TikTok? Come on, guys. And find me a date. We use Tinder and many others. So that's how encrypted is artificial intelligence in our lives today. We can't live without these people. And now, if we think about biomedical data science, it is what we do, and hopefully what you will do in the future. We also use AI. And we get to solve other problems, like, for example, will I get malaria if I travel to Africa? When we do a risk assessment for disease? Or do we need early cancer diagnostic? We need early cancer diagnostics technology, and we develop these algorithms to predict cancer. Or how many COVID vaccines do we actually need? This is a problem that we have today, right? We need to know how many times we need to be vaccinated. Or if we want to ask ourselves, how do we age? Or why do we age? or whether we can revert the aging process. Am I suffering depression? How can we detect meningitis? And all of these are projects that we are working on in my lab today. So now I would like to ask you a question. Do you think a computer can think? Think for 2 minutes. I have a list here of answers. Think for 1 minute, and then we will vote. Of course, computers today are smarter than human beings. Sure, computers think like humans. Computers can think to some extent. No way, computers are not intelligent. What does intelligence mean? So number one, computers are smarter than human beings. Don't be shy. There is no one right answer. So just don't be shy. Sure, computers think like humans. Computers can think to some extent. No way, computers are not intelligent. What does intelligence mean? Yeah, right. So I think that there is no correct answer, but I would think between 3 and 5 are the most accurate. And why? Do you know this guy? It's scary. Since 1800, we've been thinking about AI. And humans, we've been trying to create machines that think and behave like us. This is a fear that we have. And also, it's a dystopia and it's a utopia. If we think about this one, how many of you are familiar with this big eye? One there, you're too young. 2, all right. We guys in the older one, this is HAL 9000. This is from Space Odyssey. It's a computer that tried to control the spaceship and killed the pilot, or almost killed the pilot, tried to kill the pilot. In the end, he couldn't. So in the end, AI has been in science fiction for many, many decades. So how about this guy here? This is one of my favorites. In our minds, AI can reproduce this creativity that we humans have, can reproduce this sense of curiosity, of empathy, and we think or we fantasize that this machine can live in this world when we are not here anymore. This is the story of WALL-E. And this other movie, Mitchell versus the Machines, how many of you have you seen this one? I recommend this. You see this? This is a set of computers that try to conquer the world and almost succeed at doing that. And this is my actually favorite one. I don't know how many of you have seen this movie, but it shows how we fantasize with computers that can fall in love with us. Computers that have emotions, computers that have reason. And in the end, operative system falls in love with his owner, and then at some point, she decides to abandon him to pursue her state of consciousness and freedom. It's a beautiful movie. So all these different utopias and dystopias from science fiction started to be intertwined with achievements in the field of informatics. Achievements like this one, when the computer DeepMind defeats the AlphaGo world champion in 2016. So if you see the guy, he looks defeated. And he says, it's not a human move. I've never seen a human play this move. So behind the scenes, there is a convolutional neural network. And also later, there was another paper where they used reinforced learning to train on almost 5 million games. Of course, he hasn't seen this move, because he hasn't seen the whole 5 million moves. So the computer trained over all this data and was able to defeat the world champion. So we start to think that maybe Go or even chess is a test of ability. This computer has to be so smart. But if we think about this guy, the fact that you are a winner or a world champion in Go or in chess doesn't mean that you are intelligent in other aspects of your life. Maybe the programmers are very, very smart. But that's a different question. The reality is that we tend to associate analytical thinking with intelligence, but that's not enough. Then there are some media that tends to make us think or lead us to think that computers actually think. So here is, for example, at the United Nations, where they presented robot Sophia that joins the meeting, and we show her talking to UN representatives. Do we think that Sophia can really think? And then a more credible piece of news where Google fires a software engineer that claims that he has created a robot that can think like a human. So Sophia was in 2017, but today in 2022, we see that computers still cannot think like a human being. So what is the difference between machines, artificial intelligence, and human intelligence? So human intelligence is general. We don't only perform calculations or solve one specific task. We're able to create, we're able to improvise, we're able to make mistakes. And machines cannot do that yet. So we say today that AI is limited. It can perform one or mostly two tasks at the same time. So the correct word, or actually the more technical word that we use, is narrow AI, or narrow artificial intelligence, that is a task-oriented software. So is it possible that in the future we will have general artificial intelligence? Maybe. But about 50 years ago, Marvin Minsky, who is considered the father of AI, said, from 3 to 8 years, we will have a machine with the general intelligence of an average human being. 50 years have gone by, and we are still not even there. However, we can do a lot of things with AI, especially in biomedicine and bioinformatics. And here I show you an example of a credible AI article from MIT. This is a task-oriented software that was able to analyze the patterns of human breathing and actually classify patients into having Parkinson's disease and not having Parkinson's disease. And another achievement from, again, Google was last year, and you may be familiar with this paper, with this very, very famous Nature paper, where they show that they can predict the protein structure based on the DNA. And they do that very, very well. In fact, some colleagues that were doing structural biology called me that week and said, hey, it looks like we are out of a job, because these guys have solved it. It's not that they are out of the jobs. There are millions of things we can do in structural biology. But this has been almost solved, and the algorithm is open source. So solving the protein structure is very important. It's very difficult if you want to do it experimentally. And here I show you a picture of the Stanford Linear Accelerator where they crystallize proteins. Sometimes you cannot even crystallize some proteins. And knowing the crystal structure is very important for drug discovery. So let's go back to AI and what AI is today. So AI today can perform single tasks. You have data that goes into a mathematical model and produces predictions and results. With those predictions and results, we take actions. Examples of AI are, again, things that we see every day: spam filters, marketing, image recognition, autonomous vehicles, machine translation, games, diagnostics, weather forecast, and you name it. But one thing is very important to take into account. First, let me show you an example of an AI algorithm that I think you will enjoy. So this AI algorithm takes lots of faces and creates new faces of people that don't exist. It's called a fake faces algorithm. And I'm going to show you some of the pictures that this algorithm creates, and there is a fake face. Can you please tell me which face is fake? Six. Why? You know, it looks a bit too perfect, right? And look, she has only one earring. And amazingly, the other one also. has another one earring. So what about number 2? He looks a bit pale. How about number 3? Which face is fake? 4. So 4. Another kind of ring there. Yeah, that's maybe fake one. Actually, all of them are fake. And if you want to create fake faces, you have to go to thispersondoesnotexist.com and create your own. And this is quite useful for advertising and for fraud as well. So let's go back to AI. One thing that I want to say about AI is that we usually forget that AI is built by humans. So there are human beings in all the different steps of artificial intelligence. So there are humans that acquire the data, there are humans that develop, humans that analyze the data, and then there are humans that are the decision makers. So there is not much, everything about AI is artificial, but there is so much human intelligence in AI. So because there is so many humans in the loop of artificial intelligence today captures a lot of our values, our subjectivity, our egos, our beliefs, our priorities, our moral codes, and our interests. There are 2 things that happen around AI that are worth of our attention. One are the biases in AI, and the second one is the poverty of data. So in an era where we talk about big data, today I'm going to talk about data poverty. So first, let me tell you about biases. I'm sure you are familiar with these digital personal assistants. Do you see a common pattern here? They are women. So Alexa, Cortana, Aura, Siri, Irene actually from the railway stations, she was a commission, fortunately, a couple of years ago, because she was said to be dumb. So what's common about all these female digital personal assistants is that they are all helpful, they have beautiful voices, they are supportive, they are obliging, they are eager to please, even subservient. And there is a report from the UNESCO that alerted society about these biased operating systems that are encrypting a stereotype of women in the society, where if you shout at them and you mistreat them, they will answer things like, I'd blush if I could. So we sometimes live with these biases, even unconsciously, we don't know that they are there. And let me show you another one. So this is the Google Translator, and this was data that I acquired in July 2022. So this is from a few months ago. And it's a translation from Finnish, which is a neutral language, to English. So once you translate a lot of activities that are written in English, in Finnish, to English, the algorithm picks a gender. And look, he drives a car. I cannot speak the Finnish, so apologies for that. She dances. The boss is talking to his secretary. She washes the dishes, irons and cleans the house. Why not him? A nurse treats her patients. She dances the tango. The doctor is talking to the patient, neutral there, and the president makes his decision. Presidents are always men. So what's the problem there? Is that these algorithms are biased, because the programmers are biased, but they are also built on terabytes of original documents that carry these biases. Yesterday, when I was organizing this class, was looking for pictures, and I happened to put this query, 60-year-old person image, in Google Images. And look what I got. Actually, I wanted to represent AI as an old woman. And look what happened. No old women at 60 years old. So you see how surprising is this. And we sometimes live with this reality every day. So let me touch about the other topic, which is so relevant in biomedicine, is the data poverty issue. And this is a beautiful article by The Lancet from last year. The reality is that when we want to build our algorithms, not all the genders or all the races are accurately represented. Most dermatology apps are trained on white skin. Most facial recognition software are trained on white male. And then we can think that in societies that don't have enough resources, technology, for example, in Africa or Latin America, we don't get information about their health. So when we are developing risk assessment algorithms, we are not representing that society equally. Then this is also determined by location, but also by taboos in the society. For example, I'm working with cohorts of patients in COVID, and we are not tracking the menstrual period of the participants when we know that COVID, and especially long COVID, is quite related and changing the menstrual period of women. Same happens for puberty age, which we are not acquiring, and also menopause. These variables do not exist in the medical records many times and in the research many times. So we can say that because of poverty of data, these populations are underrepresented. So let me round up this part saying that AI is humanly driven, and the data that it uses to train the models is a snapshot, a photograph from our reality. If we feed a photograph that is biased into our models, you know how that goes, trash in, trash out for modeling. So what will come out from this algorithm is an unfair society tomorrow. So today, us, ourselves, as developers, which will be your role in bioinformatics from the next years, and as society and consumers of these technologies, we need to be aware of this. So I don't want to be so pessimistic. In the biomedical field, there are good news, and I love to see, I follow a lot of startups in the field here in Barcelona and globally, and to see that the fields are changing. For example, Fitbit, this watch that captures all our biomarkers, in 2019 decided to also capture menstrual periods. 2019. But that's better than nothing, right? Then we have fertility predictors, cervical cancer detection, breast cancer, and AI detection, and a whole lot of technologies called as femtech. I like to see this field growing. So now let me switch gears. I hope I have shown you a bit of what AI means. And let me share with you how I got into AI and biomedical data science. I want to tell you a bit about the career. I have to say that I don't like to speak about career as a race. Carrera in Spanish is like you're chasing something, but more like as a journey. And people have different ways and different types of journeys. So I started, as Arnaud mentioned before, in physics. Then I met biophysics and drug discovery till I got to biomedical data science and bioinformatics. You are starting now your journey. This doesn't look like a very realistic journey. Most journeys are like this. And my journey was like this too. And you can see patches of red where things didn't go great, where you had to work at other things that it wasn't what you had been trained for to survive, to pay your rent. So I had to work sometimes in a video game company or in finance or economics. It was where I was trained. No, this is what I really like. Maybe not. But there is always something to learn. So my road to where I'm now took about 20 years. But the good news is that with the program that you're taking, you'll go pretty fast if you really enjoy your career. You will learn in the bioinformatics program to understand biology, what is a DNA sequence. You will have a lot of good teachers to show you that, so that you can accelerate the path to making impact in bioinformatics and biomedicine. One thing that was very useful for me during my career is to be immersed and work with different types of biomedical data. This you will see during your career as well, when teachers give you different data sets. All of them are important. So I got to work with simulation of proteins at the beginning. Then I got to work with preclinical data and high throughput data from the pharma industry. And I'll tell you a bit more about that next. Imaging data from diagnostics and clinical data. So it's not only important that you try to diversify as much as possible in this moment of your career. At some point, you will also like to go abroad and get new ideas. This is not now, but when you finish, it will be interesting that you visit other points of view in other locations. So I'm from Argentina. I was lucky to go to USA, to work in Switzerland for the pharma company, and now I'm delighted to be here in Spain. I love football, by the way. So that's pretty obvious. So I'm more like playing than watching, but that's a different story. So in addition to different locations, it's very important that you take a look at what working in different sectors means. So there is academia and there is industry. But what you see here in the picture are two stereotypes. Academia is not formal and very, very strict. And industry is not all about making money or producing. There is great research in both, and it's worth exploring. Actually, I came to understand that the best place is the intersection of academia and industry. This is where the great technologies happen, and then they get delivered to the clinic. So the next one I'm going to show you is an example of how a project in industry works. A machine learning project in drug discovery was one of my first projects in industry. Actually, drug discovery is very difficult. When I go to a pharmacy and want to buy a drug, I'm really surprised that there is a drug for most conditions that we normally need. But there is so much to explore, and there is so much unmet need, so many drugs and so many diseases that have no cure. So actually, I think it's more or less like that. Finding the needle in the haystack. And this is probably the face of people that get to find those drugs. I hardly met a computational chemist that was involved in a successful drug discovery project because it's very difficult to happen, but it's worth the try. So this is what industry looks like. This is a pharma company. And what you see here in the left is a high-throughput screening facility. Every little shelf contains a lot of compounds and molecules that you hope that will be alleviating some type of disease. But you don't know which disease yet. And many, many of them are inactive. So there is a robot that picks these compounds and takes them to plates. And then there are these huge high-throughput screens, which there are millions of compounds tested at the same time, about 1.5 million. These high-throughput screens are very expensive. So at that time, when I was at Roche and at Novartis, I was in a project to try to minimize the amount of screening that was done using machine learning. Instead of putting all the compounds, which is impossible, on those shelves, let's try to pick the ones that are most likely to be future drugs. And we will do that with machine learning. So if you imagine chemical space is huge, how many combinations of molecules you can conceive with your mind? Millions, more than millions. This is an unsolvable problem. However, how do we approach it? The standard way of approaching drug discovery with machine learning is the following. We take a drug or a molecule that knows that it works, and we do what we call feature extraction. We take properties of this drug, the solubility, the polarity, the melting point, the boiling point, partition coefficient, and we build a mathematical vector. It's fantastic because chemistry now becomes mathematics. And then we can navigate this mathematics using informatics and data science. So what we do is we explore the surrounding space of those vectors You already are studying algebra, right? So you can calculate distance between vectors, and you can find vectors that are very similar to this vector, but not quite. So then you take the surrounding space around that molecule and you test them. First, you test these compounds in a high-throughput screen, but that high-throughput screen will be smaller and cheaper. Then, the ones that are proven to be successful compounds there are going to a cellular screen, where you actually now have the cell, the cellular membrane, and the proteins inside. Not all the compounds that succeeded in the high-throughput screen will go through the cellular membrane. It's very difficult that that happens again. And the few compounds that are still active in the cellular screen go to mouse model and further validation into human. So this is, in summary, the drug discovery pipeline and how machine learning contributes to this pipeline. In my journey, and also wanted to share other views, I had, as Arnaud mentioned, the opportunity to be in academia also working as a postdoc. And in this case, I was here in Barcelona at the Fundación Pascual Maragall, very close to here, where we started to work in the early detection of Alzheimer's disease using imaging. So Barcelona Beta is a very great initiative. What they do is they recruit family members of Alzheimer's disease patients. These family members are healthy, but their family, their elderly, have had or have been diagnosed with Alzheimer's disease. The idea here is to see if in this cohort of healthy people, we can find early signs of Alzheimer's disease and help them or prevent their having Alzheimer's disease later in their life. So a few things about Alzheimer. There are about 10 million cases in the world. It's been 100 years since it was discovered, and there is no cure yet for Alzheimer's disease. And many clinical trials have failed. So if you want to diagnose somebody of Alzheimer's disease, you can do two things, and both are invasive. One is to have a PET scan, which involves radio-labeled molecules in the brain. And the other one is a lumbar puncture here in the back. It's not that painful, but it's invasive, and people don't like to do it. So because it has no cure, today most scientists are thinking that the best solution today, to the moment, is to predict and to prevent Alzheimer's disease. But how do you recruit people that will have Alzheimer's disease in the future? How do you find them to put them in a clinical trial for prevention? I mean, they are healthy. It's very unlikely that they will want to be subject to drugs and to experimentation, right? Would you? I wouldn't. If somebody tells me, how about you take drugs, maybe in the future you will get Alzheimer's disease, I will go like, not really. But if somebody says, you are at risk, then maybe I give it a thought. So, as we thought before about chemical space, as bioinformaticians and data scientists, we also like to think about human space. So, if we're thinking about human space and we see people here, some of these people will maybe be at risk of Alzheimer's disease. Maybe they will have Alzheimer's disease in the future. How can we identify them? So if we think about cognition, there are people at risk. There are people that have mild cognitive impairment, already the symptoms of Alzheimer's disease. Some people that have dementia, and some people that are healthy. If we want to recruit people for this clinical trial for prevention, we want to focus on the people that are at risk. So how do we find them? So what we did at that time is we thought that we will combine a non-invasive technology like magnetic resonance imaging, which is non-invasive, together with machine learning, and use both together to see which people were at risk of Alzheimer's disease in the future. So people in the Barcelona Beta would provide volunteer for a brain scan, an MRI, non-invasive, some minutes in the scanner. And now that we have the brain scan, we will do what we call parcellation. and we extract regions of the brain that is pixels. So we can think about pixels, and we have millions of them, but if we think about regions of the brain, we may only have 80 regions, and the problem becomes more simplified. Then what we did is we took a set of brain scans from the public domain, which had a measurement for whether they had early Alzheimer or not. For these people, they have already measured amyloid in the brain using a lumbar puncture. So we trained a machine learning model to see if these people had early amyloid deposition or not. And once that we trained our model, we applied our models in a very different cohort. And we realized that we can actually classify with certain accuracy which people would have amyloid in the brain just by looking at the brain image. And this is a type of diagnostic tool. Actually, our accuracy in the model wasn't so high as to use it for diagnostics, but we used it for triaging the population. More interestingly, we use this, once you look at the brain and you explain your model, you can see that our model was able to pick up some regions in the brain that may be the cause of that prediction. Some regions like the hippocampus or the maybe temporal regions are regions that people know that are Alzheimer's disease signature, but we found another region, for example, the olfactory tract, here number 5, which, if you think about patients of Alzheimer's disease, one of the earlier symptoms is that they start losing the smell, just like COVID, actually. So this olfactory region came high in our prediction using machine learning. So what I learned about this project, actually, was beyond the project itself. My learning was that we have images from a patient, but we also have genetics, and we have so much about a patient or a person that we are all different. We have ethnicity, family history, occupation, location, medication, inflammation, gender, sex, age, vital signs. And if we use clinical data, for example, acquired in the medical history, we can build what we call the human signature. Each of us has a human signature, and we can use these human signatures to predict diseases. That's the type of work that we do in the lab. I think I'm almost done with the content part. And before we go to the questions that you may have, I wanted to leave with some take-home messages for people that are starting in the career. And the take-home messages for me will be quite obvious. Be curious and get into lots of scientific problems. Be shameless. Be proactive in asking professors to work with them, internships in the summer. Be shameless at asking questions and asking for help. Be shameless. Everybody likes motivated students, so there will be always people for you, especially people, your teachers in this program. Then trust yourself. I would say trust yourself, but not too much. Be critical of your results as much as you're critical of other people's results. There are a lot of bad publications out there, as we saw them before. And validate all your informatics algorithms with experimental data. This is so, so important. Next, cultivate mentorships and relationships. Mentors are very important in our career. They open doors. They provide guidance. They help us go ahead in our careers when we're feeling sad, when we're feeling demotivated. That's what mentors are for. They also help you to find jobs after and help you decide what is the best path in your career. And then I would say, find your niche of expertise. So you will end this degree, Bioinformatics, and this field is emergent. So a lot of people are studying Bioinformatics. So there is a point where you would like to focus and be an expert on one topic. So for now, in the next year, try as much as you can. Do internships, learn, read, and at some point in the future when you do maybe a PhD or pick up your job, decide that that is going to be your niche. You can later change, but there will be competition, so finding your niche will help. And I think that's it. I will tell you, enjoy your career, this beautiful program, and thank you for your attention.
Much, Paula, for this great talk. Very motivational, very inspiring. So time for questions. So we'll start with people that has priority for this session. Please raise your hand and I will come to you. Yeah.
Hi. Okay. My question here is, you said that you're diagnosing and preventing some diseases, such as Alzheimer, and the technology that you apply in this prevention will only be used for diagnose or also for accompany the patient on the treatment?
That's a great question. So at the beginning, we thought that this was going to be for diagnosis. For diagnosis, you need precision of about 90, over 90. So then we said we will use this for triaging, for deciding who will be apt or invited for a clinical trial. A later paper that we did, and I'm not showing it there, is that it shows that you can use machine learning also to show change before the snapshot of a person today and the snapshot of a person tomorrow. And when you see change, you are monitoring. So I think this approach, we haven't done the work ourselves, can be also used for monitoring that same patient. And it actually works better when you have the MRI from a person at day 1 and you have the MRI of a person 5 years later. Because you compare that person with herself and not with other people. So this was a cross-sectional study. Then we did a longitudinal study that proved much better. Thank you.
Any other question?
You said that nowadays AI is limited, but it may one day be general. How this, do you think it's possible? And if so, how would it affect biomedicine and biology?
So every time that in technology somebody said this will not happen, it happened later. So I'm an agnostic person. I will never say it's not possible. But if AI will be general, it's going to still be a long ways, but a long ways. I'm not sure whether I would get to see it. I hope to see it. In biomedicine, I think the impact is already at the moment. When we are creating algorithms, we have, for example, data labeled by several doctors. And when you use that algorithm for a diagnosis, it may help the doctor that is practicing or like actually working on the patient to have a better diagnosis, especially because that doctor has only 5 minutes to treat a patient. There's some articles out there that argue whether AI can be better than the eye of a trained doctor. I don't think it can be better, but it can be better in the practice because doctors don't have time. And also, if there is a doctor that is new, having an algorithm that is giving guidance will make him or her pay more attention on some specific features. And there is a third possibility that we can take medicine where there are no doctors. So we are working now in a very interesting project in collaboration with a company called Newborn Solutions, where we take ultrasound devices that scan the brain to Africa to scan for meningitis. But in those locations, there are not many there are not many doctors, especially in those places. And the doctors are very scarce. So having a system that will alert the nurse that there is a case of meningitis will be very helpful. Thank you.
I mean, nowadays, there is no general artificial intelligence, but why? I mean, it's because we don't have enough power. I mean, or the hardware we have nowadays it's not enough powerful, or maybe because we don't really know how to code an artificial intelligence that is as complex?
It's a nice question. I think the hardware we have enough. We don't know how to do it. We don't yet know how to mimic the human brain, especially because we may have to code a software that then will code herself.
Okay, so it means that maybe a good way to investigate that area would be to investigate the brain.
So there is a lot of neuroscience in AI working at the moment. There are a lot of neuroscientists working together with informaticians, and this is an area of huge development. There is not only neuroscientists, but also computational linguists that understand how we speak and what it means to speak and to have meaning, and also a lot of people working in the area of object recognition. Because the way we perceive objects is also a very complex task that we do with the brain. So I think there are a lot of forces joined to create a general artificial intelligence. Interestingly, AI started 1950s or 60s, where there was a very beautiful group of scientists that came together, linguists and neuroscientists, and you may hear the story of Turing with the Turing test. Around that time, there was so much linguistics, neuroscience, that they thought that it would happen. And I think they moved it very far, but not enough. So I hope that we will see it. Who knows?
Okay.
Thank you for that comment.
Hello. How could we integrate those groups that are not included in our databases, as in the case in Africa?
That's a very difficult question. I think we have to think about them. There are two ways to answer. One from the society point of view, and the other one from the algorithmic point of view, which is the easiest. Society, I think we need to encourage European projects and world projects through different foundations to reach out to those communities and remember that they exist and give them access to computers and to technology. It's interesting because most people in those areas have an iPhone, or not an iPhone, but they have a phone with Wi-Fi. So in principle, we could be acquiring data from them. So it's important that we start thinking about developing apps that will acquire at the same time as they monitor. So there is now a trend about digital medicine and digital health that is aiming at taking medicine where it's not, to remote places where it's not available. And we hope that with telemedicine we will acquire enough from those populations. That's the most complicated. Algorithmically, when you have a database and where you're working with data, just make all the checks that your data is balanced, that you balance for gender, you balance for sex, which is not the same, but that's a different discussion, that you balance for color of skin, for location. And if not, there are tools, there are algorithmic tools that you use for data balancing as much as you can. Thank you.
Hello. From your most sincere opinion and your great work experience, you consider that in the field of bioinformatics, the job opportunity and at the same time the remuneration is as good as the informers?
I love all the questions I'm having. I'm very, very impressed. And this is a very important question, so thank you for raising it. I'm very optimistic. I can only say that this is a huge field. It's emerging. When you graduate, there will be huge demand of your profiles. But it's very important that at some point, and your teachers maybe will have also your opinion and guidance, that you start learning everything, but then specializing. And you will be the best or the expert at this particular part of bioinformatics. But no, I have no worry about you guys. You will have great jobs because the field is growing And this is a great time for bioinformatics and for data science.
Hi, hello. I've seen you've studied neuroscience. And what has studying neuroscience given to you as a bioinformatic?
Okay, thanks. So I'm a generalist data scientist. I don't have yet a niche. Like I've been, but I think for the future, people should have a niche. But during my career, I went through neuroscience. I'm not a neuroscientist. When the moment time came that I had to start a project, I learned everything I could about neuroscience. And it gave me, if I have to think about what it gave me, a lot of curiosity to understand how we think. But also it gave me a lot of wish to understand how can we make the profile, the human signature, about behavior. So what will be the features and the mathematical vector that indicates how each of us behaves and each of us thinks. How can we create that vector is still something that I'm trying to develop and think in the lab. Like we have at the moment a mental health project where we try to understand and predict whether people are depressed or not by asking them questions. But what are the questions that you should integrate in that vector to mathematicalize behavior and the brain?
Hello. I have a question of when you were talking about Apple Watch and the watches.
Fitbit,
yeah. Is that our information then sold to companies to use, like to do some investigations and things like that?
I think it depends the permissions that you give to your phone. Usually we accept most of the things, and in that case, data is sold and it's transferred to other third parties. So if you don't want that to happen, you have to be very careful with what you accept. But in general, it is, yeah.
Okay, and then I have another question. I don't want to be rude or something like that, but is like any mal rollo between, I don't know how to say it in English, between the ones that work with artificial intelligence to try to prevent the diseases and the pharmaceutics to sell their products?
I don't think there is enough competition yet. I think they're all, at the same. Machine learning actually used for diagnostics is used for diagnosing a condition, but then the pharma company provides the drugs. So I don't see, or I haven't noticed any competition or bad feelings. I think AI is a technology that is used in both, and very heavily. In fact, now that you mention it, there is a whole area called digital therapeutics. These are apps using machine learning that accompany therapies. So you take your medicine and you have an app for example, diabetes that is controlling your glucose, controlling your blood pressure, and it's reminding you to take the medicine. So it actually, the adherence to the medicine that you will have is higher, and it makes the people cure or recover faster. So digital therapeutics is about machine learning, AI, data acquisition, devices, and drugs.
Hi, Paula. My name is Joan, and I was wondering when you talked to us about especially the Alzheimer's disease and how it was detected using the AI. Do you think this kind of analysis could be developed to predict when babies are born what diseases in which probability they will live with, and to make their lives easier for them and for their medical record?
Yeah, so prenatal tests are already very well established. I think there is always the opportunity for improving, but that area I think is pretty much well established based on the genetics of the person. You can do the genetic screen of a baby at the moment prenatally. What it would be more interesting is whether you could cure the baby before she's born, and there's technology starting to address that. Maybe, Hafi, do you want to?
No, I mean, maybe, do you have more questions? No? I was wondering, maybe they don't want to come to my class. That's why asking so much. Anyway, I will just take advantage of having the micro. So thank you very much, Paula, for coming, because I enjoyed your talk 4 years ago, and I mean, I loved this one, so thank you very much. But I have a question. Maybe you thought about it a long time. I mean, what do you think? Which is the best time to introduce artificial intelligence in a curricula? It should be in primary school, high school, first year of a grade. What do you think?
Wow. I think we should introduce programming, and maybe you would agree. When you are 6 and 7, very simple programming with bricks. I give that to my children. They kind of enjoy it. It's like play. And then when you start learning how to write, you start doing more complex code. But coding should be from very early stage. But that I'm biased, because I coded from when I was also 7, 8 years old. But I think programming and analytical thinking should be taught and encouraged very early on in our life. Machine learning, maybe when you are a little bit older, maybe at the end of primary school, I think we would be ready to explain a computer to classify. These are simple tasks. You can even make a game out of it. Thank you.
So we had a great talk, also great questions and
great questions
and great answers.
I loved it.
So let's thank Paula for the presentation.
I enjoyed it so much. Thank you.